Where'd it go? Where's the live? I guess. Yeah, I'm on Facebook Live. Okay, it says it here. And all right. Hello, everybody. My name is Pamgrace, and I want to invite you to Health Talks. I am the founder and CEO of DiscoverU Health, and DiscoverU Health is all about improving one's understanding of their health and also helping them to really achieve best healthcare outcomes. And so today I have the pleasure of inviting my friend, family, Julius, to the table to discuss Census 2020, why it's important in the healthcare, overall healthcare, and why it matters, especially at a time like this. So without further ado, Julius, please introduce yourself to everybody.
Yeah, so my name is Julius Valentine Maina. I am a partnership coordinator with the United States Census Bureau. In my role, my job is to essentially just educate and advocate for census completion, data equality, right? Because it's a data issue as well, and just waking people up why it's important. I do want to do my disclaimer. I am here, and anything that I say will be my opinion. I am not here officially on representing the Census Bureau, but I do work for the Census Bureau. In addition to that, I also work as the chief of staff of the commercializer. And what that is Janaea Griffin is a woman of color who came up with this idea that we need to be owning our own IP, and we need to start advancing technologies that can help communities like ours specifically. Mm-hmm. So in this health conversation, it's not only just the data, but what else can we do in terms of solutions and
Right.
and products that can really help this conversation. So
Definitely.
Thank you for having me on.
Definitely, it's a pleasure to have you on. I just felt that there's a gap when it comes to health information and reaching to the general public. So I want to make sure that people have not only the confidence, but know how to best advocate for themselves, right? Where to go get information, where to get resources, and how to not be intimidated by the healthcare system, because it's very complex and it's very nuanced. And I want to simplify the whole process by having experts on the field to come in and just share not only their observations, their opinion, but also share some facts as well that could be beneficial to the audience. So yeah, let's get started, Julius.
So what was your vision behind this? You know, I know you were going to share a little bit about your vision for DiscoverU or Health.
Yeah. So my vision for DiscoverU is really to achieve health outcomes. Like sometimes you go to the doctor or you have a health challenge and there's a lot of frustration on how to navigate, right? How to navigate my health. I don't even understand. I understand I have this diagnosis, but I don't understand what it really means to me in particular, how this impacts my life, what I need to do to improve my current health status. What type of lifestyle changes do I need to make? How do I sustain lifestyle changes? And so a lot of times I believe that the healthcare system sometimes leave people always in a state of question and never in a state of sustainable solutions, right? And so we are here not only to provide consultative support, but also direct healthcare support. So not only are we giving you the to-do list, but also we're able to help you fulfill that to-do list. So therefore, we're able to hold your hand and support you through any emotions that you may have, any questioning that you may have thereafter, and any hiccups that you may experience across the way. We want to make sure that that does not hinder you from getting to where you want to be, which is whatever ideal optimal health that may be for you. Because when your health is compromised, it just doesn't only impact you, but also impacts your family, your community, your work life, and it just has an overall ripple effect when one's health is compromised. And so, yeah.
I'm excited.
Yeah, that's what I'm doing. So anyone that wants to learn more about DiscoverU Health, please go to discoveruhealth.net. Follow us on various social media platforms, DiscoverU Health. and watch us as we continue to grow and continue to serve the community. Okay. Awesome. So let's talk about the 2020 census. First, what is the United States Census Bureau and how is it different than other federal agencies?
So I love that question. So the United Census Bureau is part of the Department of Commerce, right? Department of Commerce has about 13 different agencies. What makes the Census Bureau unique, and specifically around the 2020 census, is as an agency, we all take an oath to be apolitical and nonpartisan, right? And we have to start there because we're in a very interesting political climate. But I want people to always remember, when you think of the Census Bureau, think of apolitical and nonpartisan by law, right? In order for us to be an agency that conducts research and surveys that are for the people, the agency has to be apolitical and nonpartisan. So we're actually not bound by political pressure or anything anywhere close to that. We have to conduct surveys that are for the people, regardless of race, citizenship, gender, or any of those other things that are a lot of times politically charged. The Census Bureau is not that. We're also the biggest statistical agency in the planet, right? So anything that you see, I know a lot of times when you see data points, you see Census Bureau, right? And I encourage you now, when you think about it, just any data point that you look for, even if it's those research organizations that usually pull from our data, because we have an open source data, anybody can use our data for anything they want to do. So we are the biggest statistical agency.
Yeah. That's huge, huge. So can you go back and clarify the apolitical and nonpartisan, like simplify that for the common population?
So we say apolitical because we're not by law. So when I was sworn in, I had to take an oath. The oath was to abide by the Hatch Act. The Hatch Act that says I cannot engage in any political activity of any kind while in this position. And that is the same for all our census employees. That means we cannot lean to the left or to the right, whichever side you lean on, we cannot do that. In addition to that, everything that we do, example in Maryland, and I like to give specific examples. Maryland is on paper a blue state, right? But we have congressional representation from blue and red. So if we do any outreach in any district, I have to make sure that I do equal outreach to both congressional districts.
Got it.
If they don't exist, right? So my job is everybody has to get exactly the same education, the same outreach. And so a lot of the times I'm always trying to figure out, one, it's how do we now tailor the messaging, right? Because districts are different.
Right.
The environment is political, and people have to trust me as a government official who actually saying, we see everybody else in the government, but with me, trust me, because I'm here to advocate for everybody equally. So we can't be swayed by politics is a simple version. And although we are in the government structure, the president is at some point our boss. We're only bound by the Constitution. So as a Census Bureau employee, I answer to the Constitution first. And that's what we're here to uphold.
And one thing that you said is trust.
Yeah.
You said, oh, you can trust me. That's what you said.
You can.
So that trust word, that's a big word, and then especially when you talk about government and the people, our idea of trust is like, I feel like the general public's trust has been bruised historically, over years. And when you talk about a government official, whether you say, hey, I don't have any political view one or the other, I'm just here in the interest of the people, that is very hard to believe that we can in fact trust you with the information that we're going to provide to you about our living, our health, and et cetera. So can you elaborate on why trust is so important and why we should trust the Census Bureau? Yeah.
So it's interesting thing because I always tell people, I don't think we're going to overcome the trust gap this time around. I don't think we were going to overcome it 10 years ago. And then we did a survey called the Census Barriers, Attitudes, and Motivations Survey, CBAMS. And we try to figure out what are the biggest concerns for most people when it comes to the government across the board. And the first thing was trust. And it's not just in brown and black, like across the board, people have a distrust for government. The second thing is misinformation. So when we're trying to tackle which one can we actually attain in terms of attainable goals, we realized, well, we're not going to be the trusted voice, right? So the first thing we did, we had a Trusted Voices campaign. So for this decennial, we said, who are the trusted voices? And how do we give them the information? So my
Mm,
job became not trust me, I'm the government official. It's this
right,
information that I'm trying to give matters to your community.
right.
Trusted voice. We went to churches, barbershops,
Got it.
schools, and we said, you guys are the trusted voices. This is the information. We need you guys to understand this information. And if you believe it, please disseminate it to your information. So that's how we've dealt with the trust gap. We
Yeah,
were not here saying, please trust the government because we knew um, we were not going to overcome that.
yeah.
However, trust the information that we're giving you because it's important to your community.
Right, right. And I think the trust is built when we're able to see that, hey, even if we give you a little, you're going to use that little to make a lot. Right. So I believe there's a lack of linkage to the information that's been provided and the outcome of that information and how it comes back to benefit. So it's almost like connecting the dots. I feel like the dots are not always effectively connected and communicated, that connection being communicated back to
No, and
the participant.
I love that. It's almost like we're switching roles because that's exactly how we explain it, right? It's connecting the dots. So once
Okay.
we say that it's important to your community, the community member will be like, why is it important? Like, make it plain. And we say, well, do you use the roads, right? Do you go to school? Do you want or in Baltimore, so I live in Baltimore City now, we always say, what would you change about your community? And people are like, okay, now this conversation I can have. The
Right.
roads, the schools,
Yeah.
we have potholes, and I'll say, what if I told you that all of that is directly correlated to response rates in the census, right? Those things will not
Mm-hmm.
change if you're not an active participant in the census. And people are like, wait, nobody ever explained it that way to me because we're just hearing trust us where the government fill out the form. And I'm saying, no, if you want more teachers in your schools, if you want more doctors in the hospital, right? If you want more businesses to come to your community, fill out the census because that's how you expand the services. That's how you get the resources. And now
Yeah.
the conversation is different. And those are
Yeah.
the dots we're connecting. And then even when that is challenging, we're telling churches to say, hey, this program that we offer at church, we applied for a grant. The grant
Mm-hmm.
came from the federal government, and we were
Mm-hmm.
only able to do that because we went to the census, looked at the data, and we said we want to serve this many people. So now
Right.
churches are saying even that little program came from population count that came from federal government money. And that's
Wow.
how we're connecting the dots.
Wow. That is huge because I think that dot connection is often missed
Yep.
and also not communicated in a way in which we understand it and see it. Because I think you feel the impact of decisions that are based off of data, but you don't realize how you contribute to that. And so really emphasizing that, hey, your involvement or lack of also impacts your reality.
And if I may, about the reality, so because this is constitutionally mandated, there's a historical reality to this, right?
Yeah.
So the first census was done in 1790.
Okay.
Okay, so I always tell people, go back to 1790. Think of this country in 1790. Where were people in 1790, right? And
Mm-hmm.
then once again, straight facts were apolitical, nonpartisan. 1850 was the first time African Americans were included by name in the census, right? The first one actually said, are you free, um, slave, or white? Those were the
Mm-hmm.
three categories, right?
Mm-hmm.
So as we're learning how to properly gather the data, it's even now more important. And then now we are full participants in this, right?
Right.
We should be included in this because it's a snapshot of America. And for the first time, when we're taking a snapshot of America, unlike 1790, we're saying, please respond. There's no barrier anymore. We want to get a
Mm-hmm.
full understanding of your community and what you need. Because 1790, the framers of the Constitution said this is the only way we can put money into states, right? Based on population count, will then determine the allocation to states for schools, Medicaid programs. And over time, what we've noticed is there's always a hesitation within certain communities because historically, it wasn't just a trust gap. They have witnessed things that were not always beneficial to the community that came in the hands of government. So now, as we've written those wrongs, right? So now, Title 13 of the Constitution states we cannot use the data for anything other than providing resources to your community, right? We cannot share with the FBI, IRS, CIA, or housing agencies. It is a harder argument in some communities because these communities have watched the same government make promises And what we're saying is, please do your research, right? Look at Title 13,
Yeah.
right? Look at how this data will impact your community, but advocate for data based on a historical context and understanding that we've come a long way. And it's even more important now to be a full participant.
Wow, wow. So that's a whole history lesson.
Yeah.
But the history matters, right? The history matters
Yeah.
to show progress, but then also to show any gaps or deficiencies in that and how to improve that. One thing that you mentioned was Title 13 is almost like a shield of protection, right?
Yeah.
For the people. Like you said, that the data we're going to use is only going to be used for resources. So therefore, if we're providing data and we're not seeing resources in our community, then who is responsible for the lack of effective dissemination of resources to the community? You know?
Yeah, and I would actually answer then we are responsible, right? Because a lot of times it's when it comes to people being counted in the resources, it's strictly population based. Meaning, so right now there's $675 billion on the line. We know that, right? It's a pot of money every year that's going to be given to states. It's based on population. So if you're not counted, they're not going to allocate money for you. It's literally that simple. And so a lot of people have this crazy idea that there's this weird thing happening and the money's not being allocated equally. And the reality is populations aren't being counted. The easiest way to get an equal allocation of funding is to ensure that every community is counted, because that money doesn't change, meaning the undercount of one community might mean more money going into another community, period. And that's how it works. And so if we all get counted, we get a fair share. So the goal is let's get our fair share in every single community, because that money's not going to change. 675 billion with a B every single year.
600 and what?
75 billion annually. And that's for everything that we know. We're talking about school lunch, early childhood education, Medicaid. So that's where it's going. But we know the number, and it's 675 billion.
675 billion
Annually.
That's a lot of money.
That's what's on the line. It's dollars and cents.
Huh?
Yeah, it's dollars and cents.
It's dollars and cents. So that's a lot of money annually that we as the community, and I think I want to stress so important is I think the positive impact of this super emotionally charged political climate is at a level of awareness that's happening, right? The level of awareness, the level of self-study, the level of communication and sharing of information is so important to open the eyes of what's really going on. Because one, this number that you just shared as far as the annual budget, I've never heard of this number. And then also to understand how these funds are, again, supports various health programs in your community, and then how you may be accessing this or your loved ones may be accessing this and how to maintain it. So I think the overall arching message is engagement. We all have to be engaged in what's going on, which requires a lot. Which requires a lot from us. So I think we rely a lot on effective dissemination of information. So therefore it alleviates a little bit of burden, but at the same time it requires for us to trust the information that we're getting, and that is factual. So it's, I don't know what to call it. But...
So it's interesting, but it becomes a greater responsibility to do the research, right? And so we try to make, believe it or not, government facts accessible. So if you go to 2020census.gov, our website is actually kind of like fly, right? And then you hit get the facts. And we literally have a get the facts tab, right? Hashtag facts, because we realize facts is trending. And that's when you go there, because people are always like, I go to government site, I don't know where to look.
Right.
You have it now, get the facts, and you can see all the information. The other thing that we did, we realized there was not only an information gap, there's a language gap. So when you go to 2020census.gov, there's a little globe there. First time ever, because going online was a good thing. And I'll get to that. When you hit the globe tab, it's actually translated to almost like 25 languages. And, and me and you are Kenyan, right?
Yes. Yeah.
You can actually see all our information in Swahili.
Wow.
And it's census.gov, you hit the button and it translates the whole page into your language, and the images look like the community. Because a lot of times when we're talking about advocating, you have somebody that might not reflect the community, delivering a message that's important to the community. And people are like, eh. So now we realize it has to not only align from this is important, but we have to go the extra step as government to invite people to respond in language in communities that look like them with trusted messengers that look like them, right?
Right.
And it's the same thing that I'm sure in healthcare we see. Healthcare delivery is more impactful when it looks like the people, right? When it's culturally sensitive, right? When it understands the needs, right? So when we're having these conversations about disparities, there's an overlying theme of trust that it's important, but do your research. But let's hold the very systems accountable for them to also now reach out to us
Right.
in
Right.
message, in language,
Right.
and to be culturally sensitive, because that's what we've seen within the last, during the epidemic. And but we're
Wow.
excited to say Census Bureau was already doing that.
Wow.
Yeah.
Wow. No, that's super commendable. Because a lot of people don't feel heard because they don't feel seen.
Yep.
Right. And I think going extra step to make sure the language is there. So hey, not only I feel like I'm being heard, right? That you have someone that's able to translate, right, what I'm saying, and that you're receiving that message, but also we're able to have effective communication across the board is super important. And also that you said trusted people, right, that look
Yep.
like me. Because being in home care, a lot of our clients have freedom of choice where if you're paying out of pocket for any type of care, you are literally saying, I want someone from this ethnicity, or I want someone that has this type of experience or is able to speak this language. And we allow that. We ask those questions freely because we want to tailor the services for them. And so what I'm hearing that you guys are doing, is tailoring services to your audience to make sure that you're able to capture as much data as possible, and then use that data to properly allocate resources to the community. So I love that.
And I like the safety piece because even so we did go online for the first time ever, right? 2020. Like you can literally fill out your form online.
Hold on, this is the first time?
First time ever.
I thought this had always been.
Exactly, because you're a millennial, right? So
Oh my goodness.
for some of this old folk, right? I'm old school, right?
Right,
I'm a constitutional purist. I'm used to the paper and the pen. So yeah, in 2010, you got a paper form, you filled it out. The head of household was the one person who would be like, hey, these are how many people in my community. And for immigrant communities, what we found, and this is just one of the reasons why this is really positive change, head of household means very different things. Right? And you can have households where there's 3 families, and if only one form is coming, the notion that that one person will be able to give all the information for 3 different sets of families was short-sighted. So now that we've gone online, any head of household can go in, put in the address, and put in all the people who are under that address.
Really?
Right? Because we're the biggest statistical agency, we'll make sense of the data. And so this is first time ever. And now imagine going online during the COVID-19. If we had not gone online and if we were strictly relying on paper,
wow,
we all should have been terrified. But because we went online and because everybody was at home, as a nation, we're at 60% response rates as a nation, which is like amazing, right? But we also expanded how to complete because broadband was an issue. So you can actually call in there's 3 different ways to complete. You can go online, you could call in, and even when you call in 13 different languages. And then the paper form is still going to be available for the constitutional purists like myself. Like I waited on my paper form because I'm old school. I needed to say I did it via paper. And if you do not respond to those 3 ways, then people come knocking on your door. And the reason why I'm telling the long story is what I found out for a lot of communities, they just don't like government people coming to their door, right? The notion of a government person knocking and saying, hey, I'm the government, I want to know who's here, is terrifying for some communities.
Yeah.
Just like when you talked about home care, some people who do not reflect, some people just don't feel safe when some people come to your house. It's that simple. So what we did, our new campaign is if you fill it out before August, nobody's coming to your door.
Okay.
If you fill it out, we won't pull up.
Wow. Okay.
And you have 3 ways to fill it out. And you have until before August, but until then, educate yourself and your community why it's important to fill it out. Because when we're talking about the data, and I'm excited to talk about disparities, right? The disparity argument is also just as important as the data argument because there's a historical narrative. disparities don't just start today. Just like this distrust for government didn't start in 2020. So when
Right.
I'm educating people, it's not like communities of color just said, I don't want to trust the government this year, right? It's a historical
Right.
concern.
Right.
Um, and college students, right? That's another interesting group. There's taxes. There's all these other forms of college students. Like my mom is going to do that, but the reality is the census is very different. We need
Mm.
off-campus residents to fill it out because it's a household survey. We're counting the total population.
Right.
So if you're a
Right.
parent, right, you need to count your kids,
Yeah.
even if they don't count for tax purposes.
Right.
And fun fact, the highest unaccounted population is children under 5.
Really?
Which is, and to this day, we don't know how to figure that out, right? We're like, I don't know if your child got on your nerves and you're
Oh
filling out the
wow.
census form, you're like, you know what, you're not in this house anymore. And you didn't put the
Right.
name down. And the reason
Right.
why that's really important, we look at things like CHIP. Um,
Right. Right.
if you
And
do
so
not
break
count
that down because that's a children's health insurance program. So
exactly, so the
uh,
services for children under 5 are deeply important to all communities, right? But
mhm.
specifically to underrepresented communities because that will actually determine outcomes. So
Right.
we know early childhood matters, pre-K matters, we know free
Right.
lunch matters, but if we
Right.
don't count kids in the same communities where people are undercounted, then you can see the trajectory of children is going to be very different. So now
Right.
you get to 18 and you're like, well, what happened in these communities in 18-year-olds? I was like, the census is every 10 years.
Hmm.
A lot can happen in a child's life in 10 years, from
Yeah.
vaccines to early childhood. By the time they're in third grade, there's interesting studies on that. So we tell people when you think about the census, think about what can happen in your life in 10 years and how to protect your families and communities within a 10-year framework. And then
Hmm.
that's how you tell the story, right? You have to tell people, did you count your kids, right? Did you make sure your household was counted?
Hmm.
Because services won't come unless we count.
Okay. 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 So speaking about services, so I think you were talking about the impact of federal funding or funding for federal health programs. Excuse me. You mentioned CHIP. You also mentioned Medicaid, but I also want to talk about like reproductive health programs. So can you elaborate a little bit about the impact of again accurate data and how that again supports reproductive health programs?
Yeah, and I'm trying to pull up I had a tab for that specifically.
Okay.
But reproductive health is an interesting nuance right now. A lot of different groups have looked at how the census impacts reproductive health, right?
Hmm.
Um, People always ask the form, though, the 9 questions, one of the questions is, are you man or woman?
Yeah.
And then people are saying, well, that is problematic. And I can't speak to whether or not that's problematic, but what I can speak to is it's really important to know gender for the purpose of the census because reproductive health and when you put funding in the population,
Hmm.
um, you should actually know whether how many women are there from a biological standpoint
Okay.
because reproductive health is really just a factor of services that that group might need,
Right.
right?
Right.
To be
Right.
healthy, right? Reproductive health is not just a one-time thing. If you've ever been a mother, which I have not,
Right.
there's steps that it takes to get there. There's
Right.
health, right? What you eat, access to grocery stores and things like that. So
Right.
reproductive health as a framework, you now have to look at transportation, right?
Hmm.
You have to look at access to healthcare. You have to
Yeah.
look at how many doctors in a speciality fit into that thing. But all of that cannot be done if we're not counting how many women are in the population.
Right. Right.
So that's
Right.
why I think I like reproductive health as an overarching topic to really hone in on the census.
And I think one thing that we were talking offline was more so about like the LGBTQ community and really not trying to subscribe to, some people prefer not to subscribe to one or the other or just have different identity um, preferences. But why is it so important? Like you said, like your biological identity like at birth. Why is being very clear about that on the census so important? um
Yeah. So
yeah.
and I have to be careful with this because it is a sensitive topic. So one, I have to say that the census form is self-response,
Yeah.
meaning whatever you identify as is what you put down.
Yeah.
So we advocate for that purely. So if you're a man and you identify as a woman, you can check woman and we can't say that's wrong or right, or
Right.
vice versa.
Right.
Um, in terms of things that we've done to expand the understanding that the households have changed.
Yeah.
One of the questions asked, what is your living arrangement? So you can say, I'm living with my same-sex partner, right?
Yeah.
That's also first time ever 2020 only, right? And the
Wow.
process by which, if you ever want to expand a question, I encourage people, look at the form, it's available. You don't have to fill it out to look at it, because some things we can only change if the public says, hey, based on my identity, this is problematic. And
Mm-hmm.
then there's legislative process to change that, right?
Mm.
Um,
Okay.
that's how we got to expand the living arrangements. I'm living with my same-sex partner, things like that. But when it comes to gender as a construct, um, although we encourage people to fill it out as whatever you identify as, we always
Right.
say, please be cognizant that women just might need more services than men. And that's data. That's not me saying anything about men or women. That's
Right.
just what the healthcare system shows,
Right.
right? So it's important to identify as many women who identify as women in the survey, because that's what will determine the services for women in that community.
Right. Right. Right.
But the LGBTQ question is something that I actually foresee by 2030. Um, I think there'll be changes, right? Just like another interesting question that was challenged was the citizenship question. You know, they tried to add the citizenship question by legislative action. Um, they provided a justification that the Supreme Court said that was not justified, right? So
Mhm.
they citizenship question is not there because they saw adding the citizenship question would actually look like more people who were born and bred who would feel less likely to respond. And the
Mhm.
goal, if we're trying to invite everybody to respond, our questions have to be more as inclusive as possible. And
Right.
it's the same thing with the gender. That was the other hot topic because it's binary.
Mhm.
And as right now, it's still binary. And if it's going to change, it's not going to change for another 10 years. But in
Right.
the meantime, you should know that whatever you identify is what you check.
Right, right. And I think the biggest thing is to say is if we want to see changes, express that now because it won't happen till, like you said, 2030, right? So obviously, I'm sure there'll be tons of changes and we're already progressive, but I can only imagine in 10 years from now what things will look like. Um, but what I'm gathering is that the Census Bureau is listening and is attempting to make changes. So everything is not perfect now, but there is true attempts to make sure that everybody is counted accurately and the concerns of the people are being answered. And like one thing you mentioned is immigration. So I'm first generation Kenyan American. And so I'm very aware of immigrational status and how that's a very sensitive topic. And so you mentioned about knocking on somebody's door.
Mm-hmm.
Uh, First of all, I think the life has changed. You can't just knock on somebody's door. You cannot just show up to someone's house anymore uninvited.
Even if I know you, that's a problem.
Even if I know you, because it's like, well, you couldn't call, you couldn't text. Like, what are
Yeah.
you doing?
Yeah.
So to have a government official knocking on your door uninvited, and a lot of people may not be up to breast with all the various elements of casting your census data, right? And so you having someone knocking on your door and asking very sensitive information. One, you can feel like someone is being extremely intrusive, you can lie or feel like your life is threatened. And a lot of times, especially in this political climate, there's a lot of immigrants whose lives is threatened by the government and who feel like they really are under attack and under a microscope, right? And that they're being watched. So to voluntarily give out sensitive now data about your household or about your status or your family status, because usually you might have someone who is legal and another person who's not, and so you feel stuck in the middle. But so I'm happy that question is not on the census, right? Someone's citizenship status, and that there was direct advocacy around that. But how can we be more informed about questions like that are coming up to Congress, right? That are on the ballot or that are on questions to make sure that we know that our health and livelihood is not being compromised for those who are citizens and then for those who are not citizens but still identify the U.S. as their home.
Yeah, so we have a lot of interesting things. There's an office called the Responders Advocate Office, and all
Mm-hmm.
that is it's like an anonymous hotline you can call in and say, "Hey, I'm concerned about this question.
Yeah.
I'm not comfortable saying this. I'm not like," and then that office will literally walk you through how to advocate for whatever concern that you might have. It's called the Responders Advocate, and I start there. But the second thing is just general advocacy, knowing that if you're going to be a full participant of the democracy, citizen or not citizen, you should know your rights, right? So the positive thing that happened because of the citizenship question debate is when we lost trust, we had to rebuild trust, right? So we started going to those nonprofit organizations that work with immigrants, and we were like, we realized that even before this question, they were scared, right? So now how do we bridge that? One of the things we're doing, so let's say you don't respond and you're knocking on the door. We're working with a lot of nonprofit agencies that are now educating people when your rights are. So even if somebody comes to your door in their government, you can ask them for their information. You should ask to see a badge, right? The Census Bureau will never ask you for your social security number, your bank account number, because there's two things working against a lot of immigrant, non-English speaking populations. One, there's distrust, but two, when they do trust, there's scams and all these things. So we've done an extra step where we're now educating people, know your rights, right? Just like in the healthcare, and I'm just learning this about myself, you can ask for extra tests, right? You can ask your doctor, like, you know what, wait, no, you will not just put me in a bucket. I need the full services that I'm getting from my insurance. I need to see everything. And that is the culture that we have to now walk into, that it's okay to ask extra questions, right? It's okay to ask for people to identify themselves. And as communities of color, I think that is a new call because, but at a minimum, you are informed based on the data, and the data is what actually you can now advocate with. And it's a different argument, you know. You're a census employee, I know you took an oath, you have to be a political nonpartisan, I need to see your badge, right? So now the government employee is like, this person knows their stuff, and now they have to be on their P's and Q's. And if you hear somebody who's not working apolitical in a nonpartisan way with the badge on, report them. Right? That's part of being, you have the right to do that. So when we're talking about immigrant populations, whenever we have this conversation, then their whole posture changes. They're like, oh, we have the control here, right? You want our data. And now you're empowering people just by virtue of the data conversation. And that's the goal, right? And to alleviate fear with just empowering them with the idea of knowing their rights. So
that's awesome. That's awesome work. And actually, in doing my research preparing for this call, I have been thoroughly educated, to be honest. I was one of those people who professionally I want data, but personally, I'm like, wait a minute, I want to know all the details, why you want the data, what's it going to be used for, how would I find out about the impact of the data that I provided and my community provided. So it's being able to look at things both folds, right? Like two folds, and being able to understand that at the end of the day, data really moves the world, right?
And it's a new currency.
Yeah.
Like it's literally like you can't make an argument without data, right? So and to talk about health, because I did my research a little bit, because I was excited about this. So right now, if you just Google census and health, you get the 5 big buckets in which we gather data that you can use to, like, if you're a nonprofit, you want to expand your services, you should know what data points to pull from to ask for grant money. So we have data on disability, fertility, health insurance, and then annual capital expenditures. And the last one is just, you should know how much your state is spending in your community for specific services, right? Because when you know that, then you can actually craft the argument and say, well, they're not spending enough in this zip code. And that's where grant funding comes in. Now you can actually apply for grant and say, hey, federal government, based on your annual capital expenditures of health in that community, there's a gap. I want to apply for a grant so I can fill that gap, right? That's how now you start becoming a data. And when I say it's a new currency, that's how you can actually put dollars behind the data to get it in your community for a lot of health things. And then we talk about social determinants of health. Fertility, disability, health insurance, access to health insurance. All of that now puts a big framework and determines how healthy you are. So it's not just I went to the doctor. Right? It's do I understand how much I can be covered by health insurance, right? Do I have access to healthcare? When I go to the doctor, am I waiting 10 hours or am I waiting 3 hours? And a lot of times the waiting time is based on, if the hospital only thinks there's 100 people in the population, they're only going to staff 3 doctors. right? So if you're not counting that community, that hospital is always going to be long waiting times. Long waiting times means less quality care.
Right.
Less
Right.
quality care is access problem, transportation. So all of that, my goal is to show people it boils down to how well we count the population,
Mm-hmm.
right? And the goal
Yeah.
is, so now we have to advocate for counting and then the data and then the services in that
Right.
order.
Right. 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 In that order. Can you state that order again?
Yeah, we have to advocate for the counting of the population first,
Counting of the population.
and
Uh-huh.
then talk about the services that are there, not there, and then advocate for services, right? Because the data will reveal whether or not we're have enough services based on population, right? That's step one. And then when we find out what we already know, because most of us know there's not enough services in specific zip codes. We know
Right.
that.
Right.
And we are always like, hey, we need more services on the zip code. And you can't advocate that way. It's better of saying, hey, we don't have enough services and now the population has increased.
Right.
So federal government, please allocate more dollars to this community to expand the services. So when people say we're expanding Medicaid, we're increasing free and reduced school lunch, what they're really saying is the population has changed and we're putting more money here, right? The example that I love to give, Montgomery County, and Maryland is actually top in education. They have brilliant English as a second language service. That program is federally funded. That program would not exist if we did not count not only the population, but the expansion of in-language people. So like when I fill out the census, I'm also I identify as Kenyan. So I check Black and I put Kenyan, because you can actually identify where you're from. But what that really is saying is I might speak Swahili. So if they see an influx of Kenyan populations in one community, now they can actually put in Swahili language services in that community.
Right.
But if they never counted me,
Right.
if I never designated as Kenyan, how can they ever give me services for my specific culture, right? So that population is more than just we're counting people, but the more accurate you put down who you are and how you're represented, the more services can come that are targeted, and that's the goal: targeted services.
Targeted services. I mean, Julius, they got the right man for the job, huh?
I mean, that's what they keep telling me.
I'm sorry.
That's what they keep telling me. I'm here on calling. But no,
Man, you're
but
here
I'm a
on
data nerd.
calling for sure.
I'm a data
Because
nerd. Yeah.
I'm sorry.
No, I'm a data nerd, so I love this. I can talk about data.
No, I think it's so important because a lot of people feel data is numbers, and not everybody feels comfortable with numbers. Sometimes you think of numbers as math, or not everyone is math savvy, and so sometimes really trying to understand how these numbers again touch us on a personal level, and how you mentioned social determinants of health. So you're talking about like housing, you mentioned transportation, you mentioned infrastructure, you're talking about services, so healthcare services from a hospital level to outpatient services to community-based services, and then those that are funded by the federal government, those are maybe private-based services. So you're just talking about insurance. It covers a full umbrella of issues and topic points and hot points. But again, we can't do that without counting the individual person, right? And the health of the individual person and the need of that individual person. And so I think it's our job to self-educate ourselves, as you said, to make sure that we're counted, to make sure that we're clearly communicating what we need and what is the need for our community, and then being involved on a local level, right? On a local level, understanding where is this
75 billion.
$75 billion is going.
Yeah.
Where is that going, right? And then where is it going in our community? And then holding those who are responsible to really fulfill those agenda, right? Like
so I love that specifically because one, we actually can't do our outreach without local trusted voices, right? Mm-hmm. And so I'm a partnership coordinator for Maryland, and I told people my strategy was like grassroots. The people who are going to get the message out is not like if you never see a government work, I've done my job.
Right.
But if everybody's talking about the census, I've done my job even better. Right. But when it's all said and done, and the reason why that matters, so now let's say every community is counted 100%.
Right.
The money comes down to states, right? And then now the states are determining how do we allocate this money. The same grassroots people should be like, okay, I know we got counted,
Right.
I know what we need. Now I
Right.
can advocate for proper allocation. A lot of times we advocate for proper allocation when there's no money in the budget.
Right.
So now if we get all the money, now the grassroots have to come right back and say we advocated for an accurate count. Now we're advocating for proper allocation. And that isn't a federal conversation at all. Because
Yeah.
now the states have given the money, the feds have given the money to the states.
Hmm.
We have to keep all levels accountable, right?
All levels. Yes.
And because when we're done and we count every 10 years, in that 10 years, every single year money is being allocated, 675 billion. So now healthcare workers, anybody who's in a field where there's service delivery, this is a really important conversation because that service delivery is based on how properly, how we counted the population and how we allocated those dollars to ensure that everybody's getting their fair allocation. And that's
Wow.
how it all connects. So.
And you know what? I think this topic is more important than ever, considering the still we're in this global health pandemic, right? And this pandemic has led to, I'm sorry?
And I said the COVID, yeah.
The COVID, aka Rona. You know, the COVID-19 coronavirus and all the other names associated with this pandemic. But the factor is health, and the fact that when health is compromised, you see the full funnel, right, of how everything else is totally dismantled when health is dismantled. So essentially, the health of our economy is predicated on the health of the people. And I want to make sure that we understand how important it is not only to self-advocate, but to be really engaged in your personal health journey to make sure that resources are available in your community, because the way we as a country fail to respond to a global health crisis, I think, based off what you're saying, is maybe directly tied or correlated to maybe some of the census data and its accuracy of that, and its accuracy of having adequate healthcare workers and health responders, and making sure that we are also actively engaged about not only the health of our country, but the health of the people and all people, right? All people, regardless of financial, economic status. I think health should be that that all-encompassing, that everybody gets access to quality health, because again, it is the anchor of the country.
And I like, so earlier you used the word infrastructure, and I think, one, I'm not a doctor, I'm not a public health anything, so take that with a grain of salt. But what we've noticed is what was really tested during the COVID-19 was the infrastructure of specific communities, right? But what was even made even more alarming is the idea that public health as a crisis hits different when we did not count the population. Example, if we need to deploy 100 vaccines because we thought there was 100 people there, because we only counted 100, but we get there and there's 1,000 people. That is a public health crisis.
That is
right. Yeah. So when we talk about population being a metric we need to count in this, in while we're talking about the COVID, that's where it starts getting scary. Or to put it a different way, for the healthcare worker, if I'm being deployed to a place with 100 vaccines and I have enough hazmats for my team, and we get there and there's 1,000 people, I am even more at risk than I was when I was showing up for 100 people. Right. So now not only do we need to cover our healthcare workers with a proper population count, but we have to ensure that the communities that need the services the most, right? Because lack of infrastructure, transportation systems, they are the ones that might need this the most, but it's not gonna work well without a proper population count. And we've seen that happen right now because of COVID. We can literally look at the data and they'll tell you what communities were impacted the most. We actually released something called a household pulse survey. It was done by the census in conjunction with other bureaus, and essentially looked at some of the different factors that now impact a lot of it health. And the factors were loss of income, food scarcity, K through 12 changes, housing insecurity, and delayed Medicaid, right? These are the 5 factors we looked at. And I share that to say, if you're in any level of healthcare, anytime you see a new survey out there, what you should hear is new data points for me to advocate for my community. Wow. So even if you don't care about household pulse survey, what that means, you should look at, okay, wait, you said you looked at food scarcity in communities? That's something I care about. So now you could take that data point and say the Census Bureau said, which is now the highest standard of data, that there's food scarcity problem in a neighborhood. So government, city, we need to put money in this, right? Delayed Medicaid. And you understand this because you're in a healthcare worker.
Right.
We read it as delayed Medicaid, but if you're a healthcare worker, that means scary things. If anything is delayed in the scope of service, right? So now we need to be putting more lens. Why was it delayed? What do we need to do to put into the community to make sure that it's not delayed, right? Housing insecurity. Terrifying. If that housing insecurity exists and there's children, right? And now we group that with K through 12 education. For a lot of people, that's where they got their meals. We say free and reduced lunch, and that meant something to some people. That means they got at least 2 meals from the school. Right. So now everybody's at home. They're not getting free and reduced lunch anymore.
Yeah.
What services do we have for people who are no longer at school? And housing insecurity, plus their schools are shut down, right? That's a conversation that now when we're talking about the broader health conversation, that's why we really need to do the census. Because these other things, we can't find money if we never knew that population exists.
So. Yes. I couldn't agree more. And you share so much. I want you to really help us close out, and because you shared a lot of good things. I want you to help us close out on like maybe 3 hot points that you want us to just kind of remember, our homework, maybe our to-do, maybe some things that we should think about within our community, whether it's place of influence, whether it's our home, our church, our friend groups, any other social circles that we have. What are some key things that we either need to think about, or how can we support the census and make sure that data is adequately collected?
I love this question. So the number one is always understand what the data is saying currently about your community, right? And by that, so 2020 census.gov, get the facts and self-response rates. So right now you can see the real-time response rates in your community, right? So literally like this is not a hypothetical thing. This is not a game. Like right now you can actually see how much, based on what you heard from today, an undercount means lost money. So if you go to your community and only 60% has been counted, right now 40% of your population might not get the funding it needs. That is a crisis. That's a red flag. 2020 census.gov, get the facts, response rates, and you can filter down by county and census tract. So that's number one. The second data point that you guys need to do, census.gov/ROAM. And that one is really good because you can put in your zip code and it allows you to see the full data picture. Based on your zip code alone, it'll tell you income, it'll tell you predicted low response score, it'll tell you age, who doesn't speak English, who doesn't. And if you're a provider of any kind, you should be using that to determine how to provide services in a targeted way. But once again, that will just get you to the conversation where the census matters. So that's number one. Number two, educate yourself for yourself. And when you do, become an advocate, right? Don't become an advocate if you don't understand a word that I've said. I'm a former educator. I tell people, do not teach unless you understand. And so literally learn it for yourself. And we have all the facts, we have all the outreach materials. We even have YouTube videos in language that are actually interesting, they're hip. And once you like it, share it. Because this is an advocacy challenge that I'm giving you. So that's the homework. Once it makes sense to you, I challenge you, share it with everybody that you know. But make it make sense for you. Find that one thing that got you hooked and you're like, you know what, this is what I'm going to share on my social media. We have social media cards that you can literally use. We have all the pictures that are free. Mm-hmm. Take all our information and use it. And the third thing is, if you hear nothing else, just look at it this way. The census is a snapshot of America done every 10 years. Make sure you're included in the snapshot. That's it. Make sure when that picture of America is being taken, your cousin, your uncle, your grandmother, your pets don't count, your plants don't count. I know people are like plant moms, whatever, they don't count. But when we're taking a snapshot of America, everybody needs to be counted. And I want to speak directly to what we know right now is our hardest to count population, our immigrant and foreign born. Yeah. You were part of this country, documented, undocumented, citizen or not citizen. You are part of the American fabric. Make sure you're included in this snapshot of America every 10 years. So when we take this picture, we want all you people to be in this picture. smile being the
Okay.
picture. And lastly, there's 3 ways to complete it: online, over the phone, in paper form. And if you don't complete it 3 ways, we come a knocking. So if you don't want us to come a knocking,
Okay.
we have 3 ways to complete this form.
Right.
And with that, I just want to say thank you for this. I enjoyed this. This was good.
Awesome, awesome. Thank you so much. One thing that my biggest takeaways is that you said is educate yourself for yourself.
Yep.
There's so much power in self education. You know, no one can steal that from me. My mother always used to say, Pami, she was like, Pami, education. You know, she's no one can steal that from you. So one thing, just fill yourself up with knowledge. It's a big confident booster. It helps you really be able to articulate your concerns, your needs. And again, it helps you advocate not only for yourself, but your community. So educate yourself for yourself. And that's something that no one can take away from you, is that self-knowledge. Another thing that you said that really hit is data is the new currency. I put big stars and circles around that topic point because data is a driving factor in everything. And we want to make sure that I hope this conversation helped to destigmatize data and to really help us to befriend data and to utilize data to our vantage point. And so whether myself as a healthcare provider, or any other service provider, or any other organization, to utilize that data, especially when we talk about like small businesses, guys really use that data. And also grassroots, you mentioned a lot of grassroots organizations. Guys use that data to fill in the gap in your community and get the funding that you need to, again, to aid the overall benefit of America. And so, yeah, data is a new currency. I got that.
And I do have one more plug before you close. So JaneaGriffin.com. Remember the commercializer? And the reason why I raised that up in the data conversation, not only is data the new currency, but ownership, right? Read about IP, read about patents, read about trademarks, because we've all seen that a lot of the times we might have the best solutions for our community.
Right.
Put a patent on that, put a trademark on that, and create products around that, right? When there's a need and there's a data that supports a need, we should be creating products, solutions, and services specific to our communities. Data is the anchor, and that's the currency, but on the back end, so is ownership, right? So JaneaGriffin.com, she's a commercializer. If you have an idea, something that you wanted to try, if you just want to get trademarks, look her up, because that's what she does. She turns ideas into products or helps you commercialize your IP, because that has to be part of the data conversation as well.
Wow, ownership. Thank you so much, Julius, Valentine, Maina, for your time today. It's been a pleasure. There's been so many nuggets. I will make sure that I disseminate this information the best way I can to my friends and community. I also want to close with DiscoverU Health, guys. Learn more about DiscoverU Health as much as you can. My goal as a health advocate and a healthcare provider is also equip myself as much as I can to share with my community and to be the best leader that I can be. I'm not a clinician, but what I can do is be able to connect you to resources and allow you to empower yourself. And so thank you guys so much for your time. Can't wait for the next episode. Next episode is on Friday. The next episode on Friday, we'll be talking about COVID-19 and testing and vaccines. So there'll be 2 special guests, so make sure you stay tuned for that. And this is the first inaugural episode. So thank you so much. Thank you, Julius. I appreciate you.
And we did it exactly in an hour. So cheers. Thank you.
Yeah.
And thank you to everybody that watched. So.
Yes. So guys, go. I invite you to join me on this journey. This is my first time doing this interview style. And so, but this journey is going to be very exciting. And so I thank you guys for your grace and more importantly, for your support as I continue to have honest conversations around health. All right. Thank you. All righty. Bye-bye. Oh my God.